Welcome to Ages Fury. Randall Cox here. Hey, today we're going to get into inflammation. We're going to talk a little bit about some muscle soreness, right? These are the things that, they're going to deal with our exercise and a lot of those activities of our daily living. Hey, if this is your first time here, start by subscribing now. Let's get those notifications turned on so that you don't miss anything. Now look, when it comes to exercise, especially as we age, inflammation can derail that progress if we're not taking some type of action that's going to help reduce it. Now this holds true for, our activities of daily living and our, in our healthcare and just doing, household chores. Now, obviously, that joint mobility, look, it plays an important role as we age. And we can make certain mistakes in our 20s that, that can make, our activities of daily living more challenging as we age. We know that maintaining, flexibility and stability is important as we age. Now, people think that inflammation needs to be stomped out at all times, but look, it plays an essential role in our healing and injury repair that keeps our bodies, safe and healthy. Some inflammation is good. Now, too much is often bad. Now, the goal here is, look, you have to recognize when inflammation is simply doing its job, okay? And when that could potentially cause more problems, right? You need to look behind the scenes in the reason for that inflammation, because it's important that you're taking some type of action before things start to spiral out of control on you. Now, there are two types of inflammation. You have acute and you have chronic. Now, people are most familiar with acute inflammation. Okay, this is that redness, maybe warmth around a joint, some swelling, pain in those tissues and joints that, can be in a response to an injury, or maybe like when you cut yourself. Now, when our bodies are injured, okay, our immune systems, they're releasing white blood cells to surround and protect that area. So acute inflammation is how your body fights infections, okay, and helps speed up that healing process. So in this case, inflammation is good because it's helping to protect our bodies. Now, this process works the same if you have a virus, right, like a cold or a flu, okay? Now, in contrast, when the inflammation starts to move to the next level and starts to cause you pain and discomfort in an ongoing manner, okay, look, that immune system, it's going to continue to pump out that white blood cell, right, and prolong this process. Now, when that happens, that's what's known as chronic inflammation. Now, from the body's perspective, okay, it's under constant attack. So your immune system, man, it keeps fighting, indefinitely. And so when this happens, those white blood cells may end up attacking, nearby healthy tissues and organs. Now, for example, if you're overweight, okay, and you have more visceral fat that surround your organs, okay, the immune system, it may look at those cells as a threat and attack them with white blood cells, okay? So the longer that you're overweight, the longer your body is going to remain in that state of inflammation. Look, it's not uncommon for even young people to be so overweight that they have trouble walking or standing for any length of time. And research has shown us that chronic inflammation, okay, this can lead to heart disease, diabetes, cancer, arthritis. So what are some things that we can do to help prevent and reduce that chronic inflammation? First thing is get your cholesterol tested. Okay, high amounts of LDL cholesterol can lead to an inflammatory response in the arteries that's going to restrict that blood flow. If you're a smoker, man, you gotta quit. Look, I think it goes without saying, as everybody knows, there's just no benefit to smoking, but now science has shown us that nicotine, it's going to activate certain white blood cells, okay, which in turn is going to release toxins that can lead to increased inflammation in our bodies. Now, most of the time you don't really have to worry about acute inflammation. You can take some type of an over-the-counter pain reliever to, help relieve, that pain, or you can use cold compresses to keep that swelling down. But this is, of course, something that, you should first discuss with your doctor. And depending on the reason, you can probably let that inflammation do its work to kind of help with that healing process. But of course, there could be a cause behind that acute inflammation that may need some type of a treatment. For example, maybe there's a bacterial infection. Okay, now that may require antibiotics. So if you have a fever or, significant symptoms like, severe pain, shortness of breath, again, you're going to want to, talk to your doctor about those things. I mean, chronic inflammation is a little bit harder to deal with. Now, the problem is that chronic inflammation, okay, it's often not as noticeable because since, it may not have those physical signs as in the case of acute inflammation. So, how can you prevent or reduce inflammation that you cannot necessarily, see or feel? Now, your best avenue here, to detect if there's a chronic inflammation going on in your body is to have an evaluation completed by your doctor. Okay, he or she, they're going to review those symptoms, they're going to, perform a physical exam, they're going to probably check your blood to see what signs are showing for that inflammation. Now, probably the best approach to prevent conditions that are related to chronic inflammation goes back to the basics. Okay, you need to maintain a healthy weight. You need to, choose a healthy eating plan. You got to get plenty of sleep and you need to exercise regularly. And this, again, goes without saying that healthy eating and exercise are going to, have an especially strong impact on managing that chronic inflammation because they both help us control our weight and they can help us improve our sleep as well. Now, evidence may not be, crystal clear on specific types of food that can help reduce inflammation, but there are a number of options that science supports as steps in the right direction. Now, on the other hand, okay, there are certain foods that are associated with promoting that inflammation in our bodies. Now, by cutting back, or better yet, eliminating altogether foods like, soda, fruit juice, any food that's high in added sugar, processed meats, alcohol, a refined carb like, maybe a white bread or a pasta. Look, these can make a world of difference as these are the foods that spike our blood sugar levels, okay, which is going to lead to us being overweight. And, then we need to restrict our calories again to lose it. We don't want to do that. Now, we want to eat, more foods that are high in those antitoxins, right? They can help us, lower that inflammation. Now, some examples here are going to be, some berries, cherries, turmeric, green tea, dark leafy vegetables like a spinach or a kale. Now, Asia's Fairy, I do have a video out there. It's got my nutrition smoothie, which is very high in those antitoxins, so you might want to take a look at that. Now, as is the case with, pretty much everything else, regular exercise can help prevent against those conditions that are linked to chronic inflammation, especially things that are, deal with our heart health, heart disease, right, and that obesity. Now, of course, a healthy eating plan, look, that goes hand in hand with helping us keep our body weight under control. And when we combine that with exercise, we're coming at this thing with a two-prong approach. Now, when it comes to exercise, okay, sore muscles are sometimes viewed as a reward after a hard workout. And in fact, there are some people out there that they're not happy unless, they've got some kind of soreness going on, in their bodies after that workout. There are plenty of other people out there that can live without it. But, either way, I think all of us have probably experienced, some type of muscle soreness in our exercise programs. So what causes muscle soreness? Well, one of the consequences of a vigorous exercise, so say you're doing a lot of heavy lifting or, maybe a lot of speed work on a treadmill, is an accumulation of the lactic acid that's building up in our muscles. Now, lactic acid, okay, this is a normal byproduct of muscle metabolism, okay, but it can irritate and cause discomfort and soreness in those muscles, okay, muscle soreness that's associated with exercise. Look, this is known as delayed onset muscle soreness, which, hey, look, it can make it, difficult to walk and make life feel a little bit uncomfortable for a couple days. But the lactic acid, look, that's not the only culprit in that muscle soreness. In fact, that lactic acid, it's removed from the muscle anywhere from just a few hours to probably less than a day after that workout. Now, swelling in those muscles, okay, now that can cause soreness, for days after a workout, and that's from an influx of the white blood cells, right? And other nutrients that are flowing into those muscles that's helping to repair that damage after a tough workout. Now, the type of muscle damage that's occurring, look, this is part of the normal process of growth in our bodies, okay? That swelling and inflammation, it can build up for days, right, after workout. And that's why that muscle soreness sometimes, it's still there, 2, 3, 4 days after a workout, is it can take up to 5 days for those muscles to completely heal. Again, it's going to depend on the intensity of that workout. Now, although there's no evidence that really supports that soreness is a prerequisite for growth, as individuals certainly do get stronger, even if their bodies aren't sore. But a lot of people, they're just not satisfied unless they have some level of soreness after a workout. And there may be some rationale behind that logic. So remember, there must be microscopic damage, to the muscle fibers before we can see growth. So if you're sore, yes, that does mean that there was damage, and thus, you like to think that, hey, that growth isn't far behind. But again, there's no real evidence that supports that the soreness is necessary for growth. So, what are some things that we can do to increase muscle growth as we manage the likelihood of muscle soreness after training? Now, there have been numerous debates if pre-stretching helps prevent muscle soreness. So there have been numerous studies conducted in which, the subjects who, some completed pre-stretching prior to exercise, and then you had a group that didn't. They both reported afterwards that, both these groups were sore 48 hours after a workout. So in that particular study, it was decided that the pre-stretching, didn't really help prevent muscle soreness. Now, of course, look, there are a number of different variables that are not accounted for here. So, really, it's best to determine, if pre-stretching has an effect for you personally. Okay, now for me, I go through 15 minutes of pre-stretching about an hour before my workout. Now look, at age 60, okay, I found that, if I'm getting some of those kinks out, that pre-stretching is beneficial for me, right? So, I do see the benefits there, and it's not necessarily that I'm preventing muscle soreness, but, it's getting me ready for that workout. It's getting those joints warmed up, and I do see that as a benefit for me. Now look, everyone responds differently, of course. So I encourage you, look, experiment with different routines, find one that works best for you. I recommend that, if you have inflammation going on, maybe you talk to your doctor, especially if you're, involving medications. But, the main thing here is, you've got to figure out what's going to work best for you. Okay? Hey, please leave your comments as I work with people on their quest for better health. If you're looking for more programs that can help you out with that weight loss, nutrition, and those exercise goals, follow me on YouTube and Instagram. Thank you.